Hello, my name is Lauren. I'll be your nurse this evening. Can I have your name and your birth date? At this time, the patient will let me know what their name and their birth date is, and I'll make sure that this is the correct patient that I'm performing my assessment on. I'll let them know that I'm performing the cardiac assessment. I'll provide privacy, and I'll perform hand hygiene. At this time, I did take vital signs previously. I took blood pressure, the pulse ox, and heart rate, which were all within normal limits. I also asked the patient if they were in any pain, which they responded no. Now I'll begin on with some subjective and history. I'm going to ask the patient if they had any chest pain, which they responded no. I'm going to ask if they had any history of shortness of breath or cough. Responded no. Do you feel any fatigue? Patient said no. Do you have any swelling or excess fluid in your lower extremities, which are the arms and legs? Patient also said no. I'll ask them if they have a history of a heart attack or heart failure, any family history of heart failure, which they said no, and did they have any cardiac procedures done recently, which they also responded no. Okay, now I'm going to move on with the assessment portion of the exam. I'm going to first start with inspecting the neck. What I'm going to do is listen for a carotid bruit. Okay, so which normal, it's not present. Abnormal, you're going to hear a blowing and swishing sound. So I'm going to assess the carotid bruit in 3 different places. Okay, you're going to ask the patient to take a deep breath and exhale, then hold their breath. Okay, now at this time I didn't hear any carotid bruits. I'm now going to move on and assessing for jugular vein distension. So I'm going to have them do is turn their head to the left side of the body. I'm going to have them raise to a 30 to 40 degree angle, and I'm going to use my pen light to assess the jugular vein for any distension and any pulsation. So you hear you'll see a rhythmic pulse. Normally what they'll do is they'll measure it, and less than 3 centimeters is normal. I'm going to now palpate the carotid pulse. When you palpate the carotid pulse, you do one side at a time, and they should be equal bilaterally strength and force. Okay, now I'm going to start off with inspecting the chest wall. I'm going to palpate the apical pulse, which is located on the left side, 5th intercostal space, mid-clavicular line. So I'm going to stay here. I'm going to palpate the pulse and feel for a pulsation. Now I'm going to osculate the anatomic areas. I'm going to start off with listening for the aortic. Then I'm going to move on to the pulmonic, followed by the herbs, then the tricuspid, and then the apical or mitral. And then I'm going to listen to the apical pulse for a full minute. I'm going to note the rate and the rhythm. I'm going to listen for the S1, S2, which is the lub-dub sound. And I'm also going to note if there's any extra heart sounds, such as the S3 and S4. Now I'm going to move on to assessing for any murmurs. So what I'm going to do is change my stethoscope from the diaphragm to the bell, which is used to hear low tone sounds. Murmur is, if I hear a murmur, I'm going to hear a swishing or blowing sound, which is indicative of turbulence in the blood vessel or heart. So what I'm going to do is go backwards in the sequence I just did. So I'm going to listen to the mitral or apical. I'm going to go to the tricuspid. Then I'm going to go to the herbs point, back to the pulmonic, and then listen to the aortic valve again. So the murmurs are normally graded on a 1 to 6 scale, 1 being the lowest sound you're going to hear, or sometimes it's mostly not audible, to 6 being the loudest sound. And now that I'm finished with the exam portion of the cardiac assessment, I'm going to give my patients some health promotion. I'm going to let them know to limit their smoking and their alcohol consumption, because these are main risk factors associated with heart disease and heart failure. I'm going to tell them to limit the amount of carbs and sugars in their diet and focus on more healthy foods like fruits and vegetables, because increasing the amount of carbs and sugar in your diet can lead to diabetes, which is also a high risk factor in cardiac disease. I'm going to end the assessment with a summary of the patient's outlook of their assessment. I'm going to ask the patient if they have any questions or there is anything else that they want to tell me or add on to this point. When I'm completely done with the assessment and I said my goodbyes to the patient, I'm going to thank them for allowing me to assess them and perform hand hygiene, and I'm going to document my findings.